Many patients ask, what happens if I need a C-section? That's a good question, and as a patient who is pregnant, I advise that you consider that as a potential. Every birth, we as midwives plan that it will go perfectly, that your contractions will increase and that you'll move to pushing and you'll have a baby. However, we know that realistically there is a possibility that things may change during the course of your pregnancy that might indicate need for a medical C-section, meaning that you have some sort of medical indication, be it hypertension or diabetes or a placental issue that's growing with your baby that necessitates a C-section. We as midwives will work with you to understand what are the best recommendations as we go through your pregnancy. Now that's one way that sometimes people end up needing a C-section. The other way is when you present in labor. Sometimes labors do not go the way that we want them to. Sometimes people labor for a really long time without their bodies responding. We wish that we could answer why this happens. We often use different interventions and different ways to assist you during your labor to help prevent having to progress to a C-section. But even if we give the absolute best midwifery care, sometimes a C-section is the way that your baby needs to be born. The good thing is, at Regions Hospital, we work with excellent obstetricians who are kind and warm and want the best for you and for your baby. And the midwives have an excellent working relationship with them so that you can know that if C-section is the recommendation, all other options have been tried, and we have done everything to help protect you and your baby. Often, a C-section is unexpected and frequently is not wanted. And many times people have to work through that experience to bring it into their life and also to bring it into their child's life. No matter what, your child's birthday is very special. You still become a mother, and your job is to continue to move forward and love on that baby. We as midwives understand that having a C-section is going to be very emotional. Some people will say, I had a C-section, and they just put it behind them. Other people will have to work through it, sometimes for years. From experience, I was someone who took about 2 years to work through the experience of having a C-section with my first child. My midwives were very important to help validate the good work that I did in my pregnancy and also, during my birth. And our group of midwives here at Minnesota Community Care will do the same for you. Once a C-section, always a C-section is not the rule. For the vast majority of people, if they've had a C-section before, they likely can attempt a vaginal birth after C-section. If you are one of those patients and you would like to talk about vaginal birth after C-section, here's some information for you. About 70% of people who try a vaginal birth after a C-section have success. That's great. The most common reasons that people would not have a vaginal birth or would need to repeat a C-section would be if their body doesn't progress, if they don't dilate, or if their baby does not descend while they're pushing. And sometimes because there are complications that indicate need for a C-section because the baby is not tolerating the labor. Preparing for a vaginal birth after a C-section sometimes can be kind of complicated because you have the memories of having a C-section with your first child. The midwives here at Minnesota Community Care want to hear about your concerns and want to talk with you about them. It is not a good idea for you to ignore fears or worries from your previous birth experience and just think that if you hide them, you're going to move forward into this and everything will be fine. better to talk about them. So I encourage you to ask questions. I also encourage your support people, your partner, to come in and ask those questions too, because their belief in you and their support of you and your decisions are extremely important.